Hello everyone. In this video we are going to see how to do bowel training. So before we start we need to know what are the prerequisites that we need to keep in mind for doing bowel training. First, selection of a place. So we need to select a place where the child will be able to sit or squat comfortably, because some children may not want to go into the restroom, so they may prefer some other place. So you need to select a place according to the child's comfort. And method of communication, we have to find a word or a sound or gesture, something that the child can use to communicate, and the adult also should communicate using the same word. Then we have to find the appropriate time in which the toilet training can be done. So how to do this or how to find out the appropriate time we will see later in this video. And also finding a comfortable position is very important, because some children will be happy to squat, some children may not be able to squat, so they may be okay to sit on a commode or a potty seat. So depending on the child's comfort, we have to select the position. And then we have to find a method to engage the child, because many children, if they are made to sit for a long time, they usually may not sit. So they may want to get up and go immediately or within a minute or even before the act is over. So it is important to find some ways in which we can engage the children. And rewards are very important. That will motivate the child and encourage the child. So we need to find out the appropriate reward for the child. And the normal bowel movement is also important. When you're starting bowel training, we have to make sure that the child has normal bowel movements. When we say normal bowel movements, it means the child should not have any problems like constipation or diarrhea. If the child is having constipation, then it becomes very difficult for the child to cooperate. He may be having pain and discomfort. So it is important to address that problem first and then go on. And even if the child has loose stools or diarrhea, it is very difficult and confusing for the child. It may be stressful for the child when you start. So you make sure that you start the training when the child has normal bowel movements. Some diet consideration will be suggested in the later part of the video. So how do we select a place? Make sure it is comfortable, whichever place the child prefers. Not necessarily it should be inside the restroom, it can be outside the restroom also. You can use the potty seat. You can place the potty seat wherever the child is comfortable with, inside the restroom or outside the restroom. If the child is happy to sit on the commode, you can encourage that also. Any place is okay inside the house or outside the house. So it need not be always the restroom. You can even use the backyard. Method of communication. It can be a word that relates to this particular act. It can be a sound like poo or ka, kaka. It can be gesture or it can be action. And if the child cannot express through any of these methods, you can even use a picture card where there is a picture of a child sitting on the commode or sitting on a potty, something like that, to make the child understand better. We need to choose from the child's vocabulary. That means the child may be already using some words and making some sounds and can imitate some actions and gestures. So we have to choose from these things which the child is already using. If you are choosing action or gesture, it should be easy for the child to imitate. You can use actions like pointing at the back or sitting or squatting and showing, or you can use gestures like facial expressions where you tighten your facial muscles and you show how to push. So you can use any of these things and make sure that it is easy for the child to imitate. Using a consistent word or whichever method that you're using. So you shouldn't use one day one gesture and the next day you change the gesture or the sound. You should not do that. You should not change whichever thing that you're using. It should be consistently the same thing. So, how do we find appropriate time? We have to observe the child keenly for 3 to 5 days. We have to note the time of pausing. The child may take some time in the morning or in the afternoon or even during the evening time, the child may pass motion. So you have to note down the time that the child usually passes. And also, we need to note down the events prior to passing. Some children may pass as soon as their meal time is over, or after having a heavy meal, the child might pass, or after having a warm milk or any liquid, the child may pass, or it can be soon after the nap time, or soon after getting up from sleep in the morning. It can be anything. So, we need to observe these events, and so that it is easy for us to keep a track on the child, when to get the child to sit for the act. And we need to also observe the expressions or the indications that the child uses. Some gestures the child might use, or some sound or a word the child may use. Expressions like stiffening the body or tightening the facial muscles, going to a corner and standing, things like that the child might do. So we need to observe these things. So when we observe all these things, we will get an idea when a child is about to pass motion. So we can use that particular time to train the child. So comfortable position is also important. Otherwise, the child might feel very stressed. He may feel stressful during the process or the training. So you can make the child sit on the commode or potty seat. Try various methods, and then whichever the child is comfortable, you can make the child use that particular position. Squatting on the floor is also okay. Need not be inside the toilet. It can be outside the toilet as well, or any other place the child is happy to sit or squat. The child can even be made to squat over the adult's leg. We'll see a picture of that later. We need to provide support as needed, because some children may not get balance to squat or even sit on the commode. So at that time, the child may feel anxious that he may fall. So adequate support should be provided. Something like a heavy bucket to hold, or an iron bar to hold on to. So here you can see the child can sit on the commode with support, or can sit on a potty seat which is comfortable for the child. Squatting on the floor if the child has good balance, and squatting on the adult's leg if the child needs support. So support can be provided as follows. Coming to methods to engage the child. So we need to make the child at least sit for 10 to 15 minutes. So many children will want to run away. So it is important to use a toy or something that the child likes to make the child sit for a longer duration. So few things will include storytelling, or just a picture book for the child to go through it or turn pages. Rhymes or singing favorite song can make the child engaged, and then can help the child to sit for a long time. We can even use favorite play activities like water play or finger painting, or anything that the child likes. Next, rewarding is very important as it motivates the child. Social rewards can be a clap or pat, hug or kiss. So make sure that you will do any one of this. Material rewards like favorite toy or a play activity or something that the child likes can be given to train the child. You can even combine both. You can give social reward and also material reward. So when you are using certain toys or activities to engage the child, to make the child sit for a long time, that also can be a reward by itself. So you choose an activity or a toy that the child likes. So we can start around 18 months. You can start even before this age. There's nothing wrong in it. It might take 1 week, 3 to 4 weeks, depending on the child and the training environment. So, what is the procedure? So first we need to increase the sitting or the squatting tolerance. We can do this at any time, need not be during the time of passing motion. So during the day, at any time, you can make the child sit using their favorite toy or the activity to get the child used to sitting in one position. So once the child has achieved this sitting or squatting tolerance, you can train the child during the actual act. So once the child is ready, you have already observed the appropriate time. You have observed when the child indicates or when the child passes motion. You have seen the events that happens before that, and also the expressions and the indications the child makes. So during that time, when you know the child is about to pass, you make the child sit or squat in the appropriate place that you have already selected in the appropriate position. So you can use the word or the sound that we have already discussed, and you must have chosen the specific sound or gesture and use that to communicate to the child. So during this time, you can start engaging the child with favorite activity, and during the process, you can encourage the child to imitate the bowel movement. So you can do the action like push and things like that, and encourage the child to do so. And once the child passes motion, you can reward the child with whichever reward the child is happy to receive. If the child does not pass within 15 to 20 minutes, you can leave the child, give the child a break. On the same day, you can try again. Keep observing the child keenly and look for any kind of expressions that the child may indicate. When he or she is about to pass, then again you can take the child to the appropriate place and engage the child, follow the same procedure, and encourage the child to pass. And reward the child if he or she passes. Continue this process for 2 to 4 weeks, and the child will learn to pass whenever you take the child during the appropriate time in the appropriate place. If the child passes in the appropriate place wherever you take for more than 70% of the time, then the child clears level 1. So then he can continue this practice in his daily routine. So make sure the child follows whatever he or she has learnt in the daily routine. There are certain things that you should not do. You should not scream or shout at the child. Do not beat the child or threaten the child. And do not physically restrain the child and forcefully make the child sit in one place on the commode or potty seat or etc. Gently insist and encourage the child playfully. So, as we said already, we need to keep the bowel movements normal. So, if there is any difficulty in that, again the child might have problems. So, some recommendations for keeping the bowel movements normal would include adequate fluid intake. As we all know, we need to give children a lot of fluid in form of juice or water or soup and etc. We should always avoid biscuits and too much of milk because this can lead to constipation. Include fruits and leafy vegetables in the daily diet of the child, and this will encourage normal bowel movements. And in spite of all this, if the child still has constipation, you can try dry grapes or kismis. So the previous day we need to soak this kismis maybe 10 to 15 in warm water, and the next day you can make a juice out of it. You can crush it and make a juice and give it to the child to drink, and this really helps in bowel movements and it prevents constipation. Some of the tips and tricks that you can keep in mind are tackle one problem at a time. So some children may not want to go into the toilet, and they may not want to squat. In this case, you need to tackle one problem at a time. So you focus on the position. So you get the child to squat, need not be inside the toilet. You can try in various other places where the child is comfortable. And once the child is happy to sit for a long time, then you slowly encourage the child to get into the toilet. So if you tackle one problem at a time, then it is easy for you to train the child. If you want to train the child in all aspects perfectly in the first attempt itself, it makes the training very difficult for the child, and the child might feel very stressful. So you give time, you be flexible, try one at a time, and then encourage the child to go forward. So follow the dietary recommendations before you start the training so that it is easy for the child and for you. Do not use the favorite toy or the activity that you are using to engage the child to sit or squat during other times. So, if it is used during other times, it may not be very effective during the time of training. And another important point is we need to encourage a lot of physical activities. So, you allow the child to run, jump, climb up and down. So, this will also improve or help in the bowel movements. Some children may have physical restrictions or difficulty in their motor development. So they might not have started to walk. So those children, you can allow the child to crawl up stairs, crawl down, or if the child is still on the floor, just able to roll, then allow the child to roll on the floor for some time. So this also will improve the bowel movements. Encourage upright position. Some children, if they have not achieved head control or sitting, they may be made to lie down always. So the child may be always lying down. So this can also affect the bowel movements. So try and make the child upright in sitting position using some kind of support on the lap or against a wall, against a corner, or using some modified seating devices. Make sure that you make the child sit like this, and that can help in the bowel movements. And consistency of training. So if you have started training today, then you consistently do it every day till the child gets. If you stop in between after 2 or 3 days and then again you start, then the process will take a longer time and the child also will get confused. Once the child learns, it should be included in the regular daily routine. So regular practice in the child's routine is important to keep the skills that the child has already learned. So it is very important to practice what is learned in the daily routine. So this is level 1 bowel training. Level 2 and level 3 will be similar to that of bladder training. So you can follow the same method used to do level 2 and level 3 of bladder training. We'll be looking at bladder training in the upcoming videos. For any queries and consultation, email at childcareguidance@gmail.com.